It's been another very serious day when it comes to COVID-19, with a death in Alberta and questions about preparedness in Saskatchewan. For more on what's happening, I'm joined by Rob Brown, the host of CBC Calgary News at 6, and Nancy Carlson, the host of CBC Edmonton News at 6. Let's begin with a look at the numbers. In Alberta, there are 358 cases of COVID-19. That's up 57 since yesterday. And there's been another death, the second in Alberta. The first one was late last week. In Saskatchewan, there are now 72 cases of COVID-19, up 6 since yesterday. Today in Saskatchewan, we're looking into a document that calls into question the government's preparedness for the pandemic that also included some dire numbers about infection and mortality rates. We'll get to that story in a few minutes, but first, we start in Calgary with Rob Brown. Rob, that's where Alberta recorded its second fatality.
Yeah, it happened in a senior's home in our city, Sam. The victim in that very vulnerable demographic, a woman in her 80s, living in the Mackenzie Town Continuing Care Centre. One staff member and 2 residents have tested positive. 11 other residents are showing symptoms. Officials suspect this is a case of community spread. There are 28 cases of community spread in Alberta, 19 people in hospital, 7 in the intensive care unit, and 3 people have recovered. As you would expect, the big cities have most of the cases. Edmonton has 86, Calgary 214. That's 60% of all of Alberta's case count. And now it's in a senior's home. Officials considering new restrictions for those facilities. They know how sensitive this is.
News of this death and other potential infections in a long-term care facility will be distressing for many people. You may be listening to me right now from a long-term care facility, or you may have a loved one who lives in one. Although I want to reiterate that most people who become ill with COVID will experience only mild symptoms, it can make others very sick. This is why we have taken the extreme measures we have, and why I cannot emphasize enough the importance for all Albertans to follow all public health guidance.
And just an update on that Bonspiel story. 12 Alberta healthcare workers who attended that event have tested positive, including doctors in Edmonton, Calgary, and Red Deer, where 58 patients and 97 healthcare workers are now being contacted because of potential concerns of infection from just 3 doctors, Sam.
And Rob, in an effort to keep the case count down, we're seeing a significant decision today from the federal environment minister.
Yeah, we are, and this affects people across the country. The minister announcing he's suspending all visitor vehicle access to all national parks. In the case of a park like Banff, which has the Trans-Canada cutting across it, travelers will be allowed to drive through, but that's about it. This kicks in at midnight tonight and comes after officials say far too many people were heading into the parks in recent days. Here's the minister, followed by the mayor of Banff, who is happy to see this announcement.
Parking lots will be closed. You need to stay at home, respect social distancing practices, and avoid public gatherings. Anyone considering a visit to a Parks Canada location should cancel their trips.
Many small towns will have a sign up saying, "Thank you for visiting." We now say, "Thank you for not visiting." And this is not the time for a road trip. Everybody needs to stay home.
Okay, that's one announcement from Ottawa today, but it's not the one the Alberta government and the energy sector have been waiting for.
No, Sam, and it looks like they'll continue to wait. There was an expectation that we could see a major relief package or bailout for the sector from the feds as soon as today. It didn't come. In the meantime, there's a lot of public lobbying going on. An open letter sent to the Prime Minister signed by environmental organizations, faith and labor groups, making the argument that money should not be going to what they call failing corporations, but instead to energy workers. While experts at the U of C's School of Public Policy are suggesting Ottawa should support those companies by helping them with financing.
It's difficult to replace the revenue that's gone. So companies are going to be really cutting back. Workers are going to be laid off. We need, support for workers, but we also need to see if the companies can maintain enough liquidity so they can hire them back once we're on the other side of the valley.
One labor association reporting at least 500 layoffs in Fort McMurray so far. So, Sam, we can add conflicting views on what to do about the oil and gas sector to a growing pile of pressure-filled files on Justin Trudeau's desk.
Rob Brown is the host of CBC Calgary News at 6. Thanks, Rob. As I mentioned off the top, the big story in Saskatchewan today, CBC has obtained a document showing the Saskatchewan government's staggering early estimate of how many people in the province might die from the COVID-19 virus. And the numbers are shocking. The CBC's Guy Kenville explains.
The predicted death toll is based on at least 30% of Saskatchewan's population becoming infected. But here's a fuller breakdown of what the province says might happen in that case. About 45,000 people would need to be hospitalized, and about 15,000 would need intensive care beds. But most disturbingly, between 9,000 and 15,000 people would die from the virus. Speaking at a news conference today, officials admitted there's the potential for our health system to be overwhelmed when the pandemic reaches its peak here. But they said they've taken steps already to lessen the blow, including a slowdown on non-essential procedures. But there remain major questions about the readiness of the hospital system once the situation worsens. The estimates released today said that Saskatoon alone will need between 500 and 600 ventilators, whereas across the province, we only have a total of 91 right now. And the health minister, when asked today, said he wasn't sure when we'd get our order for more.
We're having pretty regular FPT calls right now with the federal health minister. That exact issue has been brought up many times by many of the ministers across the country. It's a concern everywhere.
Saskatchewan now has 4 confirmed cases of community transmission. That means health officials don't know how those 4 people became exposed to the virus. Now, our chief medical health officer says that's not a reason to panic, but rather a call to be more mindful the next time you reach for that box of cereal with your bare hands in the grocery aisle. Guy Kenville, CBC News, Saskatoon.
Saskatchewan is looking for more nurses to help with COVID-19 cases as they increase. The Saskatchewan Registered Nurses Association is offering emergency practicing licenses. It says the process is being expedited during the pandemic. Any nurses who are non-practicing or retired or from other jurisdictions can apply. An emergency practicing license may be granted for 90 days without fees. The Chief Medical Health Officer in Saskatchewan did provide an update on the number of cases in the province this afternoon. As I mentioned earlier, there are 6 new confirmed cases, 72 total. Dr. Saqib Shahab broke down the age demographics. 2 people are under 19 years old, 59 are between 20 and 64 years old, and 11 are 65 years and older. Health officials are also working on tracing the history of all cases.
Today, I can confirm that we have now 4 cases without a clear exposure history, 1 in the Regina area, 2 in the Saskatoon area, 1 in central Saskatchewan. So we have 4 cases without a clear exposure history. So like we discussed yesterday, this is an important inflection point in terms of these are the cases we were expecting. And now, based on that, we will be making some further recommendations today about further increasing testing for people who have not traveled.
There have been no reported deaths from the virus in Saskatchewan yet, but funeral homes are still getting ready. Funeral directors say they are prepared for any deaths related to the pandemic. Industry regulators in the province do have a plan in place. Part of that plan includes reinstating retired funeral directors or embalmers if necessary. Now to the city of Edmonton. News from there will likely impact parents looking to keep their kids busy. Nancy, your city is taking a few new safety measures.
Yeah, and that includes closing playgrounds, sledding hills, and when the time comes, spray parks won't open as scheduled. They say the hard surfaces of playgrounds aren't cleaned, and that's just too much of a risk of transmission. They are also removing picnic tables from city parks. While cross-country ski trails will no longer be maintained, river valley trails and stairs are going to remain open as long as Edmontonians observe social distancing. And when it comes to closing the playgrounds, the city is counting on people, though this is disappointing, to accept the decision.
Under the state of local emergency, there is the ability to provide some orders related to whatever enforcement we need to see. So we're going to monitor. We're going to respect that Edmontonians will honor this requirement to not use those playgrounds, but if we do see folks that aren't, we will take some steps from an order perspective by me.
The city also says for anyone still going to the airport, bus route 747 is being suspended for now from the city, but it will still be a charter service for people who work in and around the airport. Also, a heads up, if you receive a letter supposedly from the city saying it's tracking your movements through your license plate and you could be fined for not obeying self-isolation recommendations. Adam Laughlin says it is a scam and you can ignore it.
Yes, Nancy, Saskatoon's police chief warned us last week about scams, especially when it comes to buying health-related products online or just opening email links just to keep potential fraud in mind. Now, Nancy, even though that bus you mentioned isn't running, it's expected travelers are still going to be on that highway. Some may be even returning from abroad still.
Yep, so international flights are still going to the Calgary airport, and as people come back to Edmonton and surrounding areas, some First Nations between the two cities are putting a state of emergency into effect. So the chiefs of Samson, Ermineskin, Louisville Tribe, and Montana First Nations, they made the announcement today through Facebook. Maskwacis is about 100 kilometers south of Edmonton. They say their position between the two major cities and the airports, it leaves them vulnerable. So the communities are calling on the federal government to provide them with the necessary funds and resources to deal with a potential outbreak. The regional chief of the Assembly of First Nations Alberta has said coronavirus could be devastating in First Nations communities because they don't have the same level of healthcare as big cities. And also, I have a follow-up to a story we brought you yesterday. So in Calgary, hunters are stocking up on supplies. Well, some outfitters in Edmonton say they're seeing a spike in ammunition sales. Our reporter spoke to the owner of a gun shop here, and he didn't want to appear on camera, but he did tell us it's hard to keep bullets on the shelves. But it isn't because people want to go hunting, it's for self-defense. Edmonton resident seen here at a local gun range, David McDonald, recently went to a Cabela's in Edmonton to look for a hunting rifle, not related to self-defense. He's actually the one who alerted us to this issue, and he says some shelves were just bare.
They have a thing called a gun library, which is where they keep all the used firearms, and I did overhear one of the associates saying that that was the most empty he'd ever seen it. And there was a couple of racks that were fairly picked over.
If you do want to read more about ammunition sales in Alberta right now, including more on what the local outfitter had to say, we do have a full article at cbc.ca/Edmonton, Sam.
Thanks, Nancy. Nancy Carlson is the host of CBC Edmonton News at 6. WestJet has laid off nearly 7,000 employees, almost half its workforce. It's in an effort to ensure its survival as the global pandemic continues to eat into its bottom line. The Calgary-based airline says 90% of the layoffs were voluntary, and it has praised its employees for making a difficult decision.
My utmost respect and admiration goes out to each of you who made this tremendous contribution. And I commend those who chose to stand down so that our airline can stand up.
Last week, the airline offered employees several options, including an unpaid leave of absence, early retirement, or reduced hours of pay. The layoffs are expected to last at least 3 months. On top of the layoffs, the company's executives have taken a 50% pay cut. WestJet says it will continue to operate domestically, as well as providing repatriation flights to Canadians aboard. A 7-Eleven store in downtown Calgary has been temporarily closed after a worker there tested positive for COVID-19. Staff at the store have been asked to self-isolate with pay for 14 days. The company is asking anyone who visited the store between March 4th and 17th to contact Alberta Health Services at 811. The store is closed while it's being cleaned and sanitized and will reopen once AHS determines that it's safe. This pandemic continues to cause challenges for social service providers and their clients across the prairies. In Calgary, people who work with the city's homeless population are making sure they know about their community resource options. Staff are continuing to provide help while following COVID-19 safety protocols when it comes to food, shelter, clothing, transportation, and health issues.
It's obviously quite intense out there in terms of just limited resources, trying to figure out, where we can take people to. Obviously, are most likely trying to get people to, if they're able to, go to a shelter, and a lot of it is around educating them on what's kind of happening overall.
I access a lot of the nonprofit associations around the city, and they're closed. And I suffer from schizophrenia, and they're closed too. Canadian Mental Health is closed that I usually go and eat to and have something, and they're closed too. So a lot of the nonprofits are closed, and I find that I find it kind of hard on myself right now with this pandemic happening.
In Saskatchewan, the Ministry of Social Services says it has made some allowances for people on income assistance. It says people who can't do the required reporting can still get their payments, but it says people who can report still need to do so. Carol, lots of people left facing change with many questions, and hopefully in the coming days we'll have more answers.